Hey guys, thank you for tuning in to another episode of InRange. This is a video I really don't want to do, but it's a video I feel compelled to do. We're all aware, of course, of COVID-19 and the coronavirus issue that's going on in the world. And if we look at things that have been going on in places where we already have analytical data in which the right steps were not taken, we're seeing really catastrophic events as a result of it. And it's not that healthy individuals don't generally survive this. It's that the system gets overwhelmed with individuals who are affected by it, whether they were healthy individuals that happened to get a particularly bad case of it, or they were immunocompromised, or in an age bracket in which they were particularly susceptible to the risks that COVID-19 can affect them with. And so I've been really soul searching in regards to this, and I believe here at InRange we have always taken the most logical, scientific, rational approach to topics that we can, and hopefully are leaders in that regard in terms of the community space that we exist and live in. And in that regard, I'm looking at the data and I'm looking at things like, for example, the Arizona governor has recently declared a requirement to not have gatherings of greater than 50 people. And we go back, and let's take some history into mind, and we go back to the 1918-1919 Spanish flu influenza pandemic, and social isolation was ultimately what made a lot of that stem down to the point where the health and medical resources of the time could facilitate helping people survive that particular pandemic. And what we need to do at this point is, by having social distancing from one another, we reduce the infection rate. It's not that the same amount of people won't get infected over time, it's that the same amount of people get affected over a longer duration of time. So there's not this peak infection rate. And therefore, since it stays at a lower number, those that need actual medical care can get it and receive it and hopefully survive this particular problem. It's also another thing of social responsibility. When you're running the event, one of the things that's paramount, of course, we joke around safety third, but that's not true. Safety is always first and foremost in all of our events. And people see that our events are different and unique, where we run with guns the way we do and etc. And they don't understand, but the reality is safety is always paramount. And one of the things that's paramount to safety at this moment is to ensure the safety of all of the participants at our match. But not just the participants at the match, but the people around those people that are in their world as well. You may be a 27-year-old extremely healthy individual, and so you going out to the match and potentially coming in contact with COVID-19 is not that big of a concern to you, because percentile-wise, the chances of you having anything other than a severe flu symptom and getting over it in a week or two is statistically great. However, what about the people around you? What about your grandparents or or even your parents, or someone around you that has other underlying medical issues, or someone that you don't even know that you're now a carrier for that has those types of issues in public? I don't want that responsibility on my head, and I would hope that my match competitors and the viewers of InRange would appreciate a scientific and logical and rational approach to this. This isn't panic. This isn't anything of that sort. This is the natural thing to do at this point, based on the best recommendations of the best scientific minds, to make sure that we control this particular pandemic in the best way possible. So in that regard, the 2-gun action challenge match this month is going to be canceled. I don't know about the following months. We will pursue this and watch this very carefully. Maybe we'll have one next month, but I do not feel that it is morally right to have one this month. And the upcoming announced Woodland Brutality is also going to be canceled. Not canceled, let me correct that. That one will be postponed. We will let you know what the next dates are. Looks like it might be October. World War III Brutality is still on the plate. None of that's changed at all, and we should be out of this pandemic by then, by any definable explanation of the word defined. So this month, 2-gun is going to be canceled. Woodland Brutality is going to be postponed, and this is done for the purposes of not only the safety and health of our participants, but the safety and health of our society around us. And hopefully we here are leading the way and making the right decisions in our community to make sure that we all consider this and do the right thing amongst ourselves. Because it's ultimately us making the right decisions, not just for ourselves, but for those around us, to make this world a better place. Thanks for watching.